Ehrlichiosis is a tick-borne disease commonly known in the veterinarian community to infect dogs. However, it does infect humans as well. Three main bacteria within the Ehrlichiae family cause ehrlichiosis: Chaffinesis, Ewingi, and Canis, all belonging to the Anaplasmaticeae family. All these bacteria are gram-negative Coccobacillus, and they have a unique life cycle from other bacteria. Normally, bacteria divide by themselves. However, these Ehrlichiae bacteria, are obligate intracellular bacteria, very similar to viruses. They have to enter a host cell and divide in the host cell. The host cell of choice for these bacteria are mononuclear phagocytic cells, and that's because on their cell wall they have a protein that can bind to a receptor on these phagocytic cells. These cells are white blood cells, and they're usually monocytes. Once inside the cell, these Ehrlichiae bacteria form an endosome, which is a separate compartment from the rest of the cell. Inside that endosome, these bacteria replicate. These bacteria are able to evade the host's immune system by inhibiting proper phagocytosis of the gram-negative bacilli. And they do this through inhibiting the fusion of the phagosome and the lysosome. On this photo present on the screen, you see a phagosome coming into the cell, so the bacteria still get engulfed into the cell. However, the lysosome usually fuses with that phagosome, and that has the enzymes that break up the bacteria. Inhibiting that fusion, the bacteria never get destroyed. The primary vector for these bacteria is the Lone Star tick, and the primary reservoir are vertebrates, mainly deers and coyotes. The transmission cycle begins when the female tick lays an egg that eventually hatches into larvae. These larvae are infection-free from the bacteria, until they have a blood meal of their own from an infected vertebrate, and then the bacteria enters that larvae. Larvae develop into nymphs, and then the nymphs can directly pass the disease to another host, and sometimes that happens to be a human. In order for the Ehrlichiae bacteria to establish an infection in the host, the tick needs to be attached and feeding for 24 hours. Then the bacteria can enter through the tick bite through the skin and infect the host. Moving on to the epidemiology. Ehrlichiosis first became a reportable disease in 1999. Both Chaffinesis and Ewingi can cause symptoms in humans, but the vast majority of the cases seen in the U.S. are due to Chaffinesis. And since its debut as a notifiable disease, we've seen an increased rate of ehrlichiosis until 2009, but then we had a significant decrease in 2010. And fortunately, the fatality rate has steadily declined. The average amount of cases is 3.2 per million individuals. The disease is mainly present in the southeastern and south central parts of the U.S. Although the disease can be contracted any month of the year, it is most common to contract this disease in the summer months. That is because the Lone Star ticks are maturing to their adult form during that time period. If an individual contracts ehrlichiosis, symptoms begin to develop within 1 to 2 weeks of being infected. These symptoms include fever, headache, chills, muscle aches, nausea, and red eyes. While in children, they have a rash that isn't present in adults. The severity differs from case to case, and in very serious cases, you may develop breathing problems or even a bleeding disorder. So how do we avoid these symptoms? How do we avoid ehrlichiosis? Well, the best way is to avoid the tick vector that causes them in the southeastern and south central parts of the U.S. And if you must hike and go to the range where these ticks are, then it is advised that you stay on the trail, avoid the tall grass when hiking, use repellent that contains at least 20% DEET. After each outing, bathe and conduct a tick check on yourself, as well as your pets, and tumble dry your gear and clothes on high heat for 10 minutes to avoid bringing ticks into your house. If the previous prevention measures fail and you still find a tick in your body, then immediate removal of the tick using tweezers and specifically getting the tick head removed is very important. Avoid home remedies such as heat or Vaseline, and once you remove the tick and the tick head, safely clean the site. Also, remember, transmission of ehrlichiosis requires 24 to 48 hours, so quick removal is key. And afterwards, monitor your body for symptoms such as fever, muscle aches, joint pain, or rash at the site of the bite. Sometimes, however, prevention measures fall short and an individual develops symptoms of ehrlichiosis, they get an infection, and to treat these symptoms, to treat this infection, it's recommended to see your physician as early as possible. Now, this is because there's specialized lab testing that requires time to confirm ehrlichiosis. If confirmation occurs, then doxycycline is administered to the patient. If the patient is treated early within the first 5 days of infection, then the fever usually subsides within 24 to 72 hours. Doxycycline isn't without its side effects as well. It's a bacteriostatic medication that will inhibit bacterial cell growth, and for this reason, some patients will continue to experience headache, weakness for a few weeks even after treatment. Certain activities and lifestyles, in addition to existing medical conditions, put someone at greater risk for contracting ehrlichiosis. Risk factors associated with one's lifestyle include being outdoors, especially in the spring and summer, and visiting areas where the Lone Star tick is common. Males in their 50s and 60s are more likely to contract ehrlichiosis due to an increase in outdoor recreation during that time of life. Existing medical conditions also influences one's likelihood of developing ehrlichiosis. A weakened immune system, often a result of conditions like HIV, AIDS, or cancer, can lead to more severe symptoms such as kidney failure, respiratory failure, and coma.